Hi, Dr. Rich Vanderloo, Vanderloo Chiropractic West, Portland, Oregon. Back tonight talking about subluxation, degeneration, otherwise known as osteoarthritis of the spine. So, what is osteoarthritis of the spine? I think it's fair to start there. So, as we went over before, and if you haven't checked out some of my other videos, these segments, the spine, is wrapped in really broad, strong ligaments. Okay, like if I was to take this and wrap it in duct tape. When we have injuries that take place as a child, the ligaments and soft tissues that wrap the vertebrae and joint capsules can stretch or even tear, and then it heals that way. Just if I was to break my arm and not set my arm, it's still going to heal. It just heals misaligned. No different than on the inside. So once that happens, the only way the spine can stay healthy is proper movement. Well, once that happens, the spine can't move properly. So the disc starts to dehydrate. The ligaments that attach the bones, they start to fill up with calcium, and we start to get these bone spurs. So I'll do this a little slower this time. So this is a healthy one. And so the injury takes place generally here when we're young. And then as we age, every time we put our body under stress, it hits this weak spot. And this will make sense a little bit later here too. So you can see the disc is starting to pancake out. The vertebral bodies are starting to warp. And then we have herniation. You can see that red spot there. That's a disc herniation, and then we have the disc continuing to pancake and degenerate. The calcium is starting to go into the ligaments that support the joint, and then we finally have the beginning of fusion. So this is really ugly. This is really far gone. This has been someone that's been injured, and it's been wearing out for years and years and years. So I guess we should go over some misconceptions, because not everyone knows what subluxation degeneration is, and some people know it as osteoarthritis of the spine, because well, most people are medical minded. So what's the difference, or what are some misconceptions? So the misconception is that this happens normally as we age and that it's unpreventable. Well, not true. It is preventable by chiropractic adjustments. That's actually the only way to prevent it. Because if you go to the medical doctor, they're going to say, it's normal for your age. They're medical doctors, so they're going to prescribe medicine, or they're going to prescribe surgery where they go in and clean up the IVF or the hole where the nerve comes out. And they'll also, a lot of times, do like a discectomy or a laminectomy to give more relief. So I guess the bottom line is, how do we treat subluxation degeneration or osteoarthritis of the spine? Well, the answer is pretty simple. We have to isolate the joint and actually move it to increase the function. Now, when we're dealing with anything in the human body, physiology-wise, we have to do it with consistency and repetition over time to obtain a result. So just like if you were to work out or go on a diet or want to get more flexible, anything with the human body, it's no differently than with subluxation degeneration. We have to, first of all, evaluate the spine, take pictures on x-ray, see where it's at, and then we do adjustments on subluxations to take pressure off the nerves and increase function and range of motion. We do that. We do the adjustment, that is, and then the body's instinct is to start to tighten back up. And before it gets back to where it was, we adjust it again. And before it gets back to where it was, we adjust it again. And then again and again and again, until pretty soon it's a healthier joint and it's functioning normally like the other ones around it. So, long story short, osteoarthritis happens, it first starts when we're little, and then over time, as we put our body under stress, it worsens. The only way to prevent it is through chiropractic adjustments. Medical doctors are going to call subluxation degeneration, osteoarthritis of the spine, and they're going to prescribe medication and then eventually surgery. Chiropractors are going to, we would do an examination and then take x-rays and then adjust the spine to take pressure off the nerves, and it actually breaks up the adhesion and becomes healthy. So the next time that you hear about having arthritis, or someone you know might say, I have arthritis in my back, instead of rushing to go get medication or get a surgical evaluation, go to your chiropractor. See what they have to say first. There could be something that could be done about your problem, a lot less invasive and a lot less. Chiropractor is giving you recommendations to get adjusted because of subluxation degeneration or osteoarthritis of the spine, then I would take their advice. All right, this is Dr. Rich Vanderloo, Vanderloo Chiropractic West, where you come for pain and stay for health. Take care, everybody.